I will show you the barrier devices. Barrier devices is the devices that you are using in CPR so as to protect the provider from infection, or the victim sometimes have secretion like blood or mucus. Barrier devices, first is face shield. This is the face shield, not permeable to air. Here this is permeable to air. You put it on the mouse and you seal, good seal to the mouse. This is face shield. Another barrier device is pocket mask. This pocket mask is available in, can buy from pharmacy. You keep it in your car. We can use it, the tape to the BO nozzle bridge and the broad to the chin, using 3 fingers and pressing hard so as to make a good seal. And here you use 2 fingers and you tilt the head tilt can lift, and you give to breast washing chest rise. Another barrier devices is what we call bag valve mask. This, when you are using this, and usually in hospital for healthcare professionals, you should be at the head of the victims, head of your victim, and using CE technique. C for the mask, and the E, you are holding the chin and opening the airway like this. Your right hand squeeze the back and give press, watching for chest rise. This is a bag valve mask, usually in hospital, sometimes with air and sometimes with connected to oxygen. Now I am going to speak about AAD, and I will show you a demonstration how to use AAD. AAD stands for Automated External Defibrillators. We use it when we want to shock a victim whose heart stops, and to aim that this shock will return the heart to the normal rhythm. We use AAD once available. You should use the AAD once available and use it as early as possible. Here, this is the AAD machine. The AAD machine, there is different type, different shape, but most of them with a battery. And some of them you need to connect to electric power. Why it is important to use the AAD machine or defibrillation early? Because the effectiveness of the AAD machine decreases with time. The probability of successful defibrillation diminishes rapidly over time. It means that if you use it now, better than to use it after 1 hour. If you use it after 1 hour, better than 2 hours. What are the correct steps common to operation of all AAD machines? The first step, you should power on the machine. If it is with battery. If no battery, connect to electric power. Second step, select the pad. These are pads. There is adult pads and there is children pads. Select the adult pad for adult victims and connect the pad. Here, first, one of the pad connected to the upper right of the sternum. The other one at the apex or lower left. Upper right and lower left. This is connection of the machine. And don't forget to connect to the device. Third step, you need to analyze the situation, whether the victim needs shock or not. The machine itself will give you a message after analysis. If the message from the machine told you that deliver shock or shock advised, you should clear the victims by saying, I am clear, you are clear, or are clear, and then after that shock the victim by pressing this button. After the machine become ready, it will light, and press it, shock the machine. Once you shock and the shock delivered to the victim muscles will jerk. This means that you deliver the shock to the victim. Immediately after this shock, do CPR by 30 chest compression and 2 breath. 5 cycles of CPR. After this 5 cycles, again check for pulse and for breathing. When you want to shock the patient, you need to clear from victim and stay away from the victim. Why? What might happen if you touch the victims while you are delivering shock to the victim? The AAD could shock you while it shocks the victim. I am going to talk to you and to explain to you important point about choking. And I will demonstrate to you the steps how to relieve choking. Choking means foreign body airway obstruction. Piece of meat, coin in children. Choking could be severe or mild. Mild, no interference. You should only observe, watch, and encourage victim to cough. In severe choking, you need to interfere. The question, what is the best way to relieve choking in a responsive adult? You perform abdominal thrust, and which we call Heimlich maneuver. Now I will show you the steps of severe choking. The first step, if you watch anyone who is choking, introduce yourself that you are healthcare, you are BLS provider and you want to help him. Assess the victim whether he is choking or not by asking him, are you choking? Are you choking? Hey, are you choking? If he not, this means that his choking is severe, he cannot talk. And you watch the universal sign. He is catching his neck like this. This is what we call universal sign. Immediately come behind him, stand behind him, put your leg between his leg and lean him forward so as gravity can help you. And use your fist. Thumb inside. Close your thumb inside and put the fist in the upper abdomen here. And put the other hand on the top of the first and between the upper abdomen, between the navel and the xiphosternum here. And start to push inward, back, inward, upward. Inward, upward. pushing. This is Heimlich maneuver, what we call abdominal thrust, until you expel the foreign body. If the victim is obese or pregnant, you need to do a chest thrust, because you cannot embarrass your victim. So, or in the pregnant, you can injure her baby. So you should do chest thrust until you expel the foreign body. If the victim, you cannot expel the foreign body by your maneuver, Heimlich maneuver, and the victim becomes unconscious, smoothly put him on the floor, smoothly and gently, and start to give him breathing. And before breathing, activate 997, asking for help, open airway, and ventilate. If you could not ventilate, immediately start CPR by 30 chest compression and 2 breaths, 30 chest compression. And at any time you open the airway, you look for the foreign body. If you saw it, remove it. Now I will show you the steps of choking in children. Choking in children is similar and typical, all the steps like the adult. Only the child is small, so you need to lean down, or you can hold the child and you do the same thing as adult by Heimlich maneuver, and you do abdominal thrust. Relieving of choking in infant. As I remember, you remember, infant is a victim of less than 1 year old. First, you need to confirm there is choking by severe choking, that the infant cannot cry, cannot cough, and there is coloration, change of the color of the face, becomes cyanotic, and cannot breathe. This means that this is severe choking. So, you need to do what we call 5 back blows and 5 chest thrusts. This is a maneuver to relieve choking in infant. 5 back blows and 5 chest thrusts. You hold the child by your forearm, and hold the child in your forearm and stabilize your forearm by your leg. Stabilize the head here, and you give 5 back blows between the scapula. 1, 2, 3, 4, 5. Then sandwich the infant and turn him to your forearm of your left hand and stabilize your forearm with your thigh and give him 5 chest thrusts. Don't forget to stabilize the head. 1, 2, 3, 4, 5. Again, sandwich the infant and turn him to your right hand, right leg, thigh, and again you give 5 back below. You keep repeating this maneuver until the victims expel the foreign body, or the other scenario, become unconscious. If the victim become unconscious, immediately put your victim on firm flat surface, smoothly, gently, and call 997 and start CPR. The modification here, whenever you open the airway, look for foreign body. If you saw it, remove it. but don't move it blindly.